Or just do what Joe does.
Take a picture.
Just
That's
videotape everything. Okay, so.
I learned by writing it down. I can't just take a picture.
That's right. Okay, so 3 capsular tests we're going to talk about. The first one, because it's a little bit different than the second 2, is simply a posterior capsular stretch here. Okay, and with her, she's not getting all the way down to the table. What we're going to do, we're going to wind her up into this position here, and we're just going to shear down. Okay, it does have to have something of a lateral motion to it, otherwise you're going to just run right into the glenoid rim. Okay, that's easy enough, right? Checking for stability there. This next one is one that I tend to use more in clinic, and this is one that Earl Pettman has been teaching, and he's been preaching fantastic consistency and reliability, and as far as being able to actually pick up capsular lesions. So I do use this, and it does work. So when you come in here, basically the same position as where we're in to test the anterior inferior band here. We're going to fix the inferior glenoid tubercle. You got to get a baseline here. So you got to give it a little pull in neutral. Get an idea of what the mobility looks like there. See, she's got a little give. And then we're going to wind her up. Okay, so internally rotating or medially rotating will tighten the posterior portion of the capsule. And we should see much less movement when we tighten that up. Okay, increased movement means it's pretty lax. Yeah. Just the opposite, we'll externally rotate her to tighten the anterior capsule, and same deal, should be tighter. Okay? Those are the 3 capsular tests. Anything to add, Gail?
The only thing that I do different is on the posterior stress test to try to get from 9 o'clock to 12 o'clock position of the posterior capsule is middle, superior,
So a
inferior.
little different angle.
Just hit the angles a little bit. And you should, like when we think capsular, we often think hypomobility. But your hypomobility has been assessed in your passive mobility and your glides. And so now we're looking for, again, vents in the capsule. Okay, so the other thing on the posterior portion, like when you're doing the shear, get your finger right on that joint line where I told you and see if you can feel it. Because sometimes these are small, but they just, you know, when it's breaking through, it does feel like a little marble.
Good, good. Let's do those because we got to do the biceps, and that's